Lung cancer is the second most common cancer and the leading cause of cancer deaths in both men and women, but the number of Americans who survive a lung cancer diagnosis is rising. A new study from the American Lung Association shows the 5-year survival rate climbed 26%, and the rate of new diagnoses has dropped 19%. Joining us to talk about early diagnosis and treatment is Dr. Jennifer Marks. She is a thoracic surgeon at the Medical Center of Aurora. Thank you so much for joining us today, Dr. Marks. The American Lung Association says an early diagnosis can make survival rates 5 times higher. What are the symptoms people should look for?
Well, that's the problem with lung cancer. There may not be symptoms very early on. Symptoms generally only tend to happen once the disease is much later in stage. Things like a change in a chronic cough, spitting up blood, even chest pain. That's why we really advocate for screening in those patients who are high risk, because lung cancer often has no symptoms until it's advanced stage.
And you touched on exactly what I was going to ask you next. Why are most lung cancer diagnoses so late?
Because they start growing very slowly as nodules out in the periphery of the lung, and they don't lead to symptoms. And so it's very difficult to find them unless you're looking for them in those certain high-risk patients.
Dr. Marks, what are the treatment options for someone who is newly diagnosed?
The treatment options depend on the stage of disease. Certainly the earlier we find it, the more options we have available. Surgery is the gold standard for early stage disease in patients who can tolerate surgery. We also have options such as radiation and chemotherapy once the disease stage gets to be a little bit later, or if the patient is not a surgical candidate.
And what are something that we can all do to lower our risks?
So don't smoke, and stop smoking if you are a current smoker. And we should encourage anyone in our family or friends or loved one who are heavy smokers to speak with their physicians to see if they are a candidate for lung cancer screening.
For someone who wants to learn more about this, if they themselves fear that they might have lung cancer, where can they go for more information?
The American Lung Association is a great place to start. They could also go to the local Sarah Cannon website. Sarah Cannon is our oncology service line for Health One, and there's a lot of information on there about a variety of cancers. November is also Lung Cancer Awareness Month, and so if you just Google that, there will lead you to a lot of good information about who is a candidate for screening and what we can do to help find more early stage disease.
Thank you so much for joining us today, Dr. Marks. You can find more information and resources as well on lung cancer on the Your Health Matters page on our website, thedenverchannel.com. And don't forget, you can help the fight against all cancers by donating to the Denver 7 November team.